Karen Tully, continuing to report from UNMANDATE, Maryland. And we have Matt McBride, a little bit different of a speaker today because you really are an expert in a lot of statistical analysis as well as working with other pandemics. Tell us a little bit about yourself and why people should even listen to you.
Well, I have been in healthcare policy for 25 years. 4 of those years were spent with the HHS Office of the Assistant Secretary for Preparedness and Response, which is the Federal Pandemic Response Authority. I wrote the H1N1 After Action Report. I was also...
Hold on. What's that? What's the
H1N1 was the last pandemic that we had. It was the first pandemic in 40 years, and so there was no institutional knowledge across the federal government about how to respond to pandemics. So my job was to gather all the information across the federal health care spectrum, compile it in one report so that they could respond effectively to the next pandemic, which is COVID-19.
Now, you have also worked in other organizations that gives you a background?
Yes, I have considerable experience in healthcare systems. That's really my area of expertise, including 5 years working with the Medicare program preventing fraud, waste, and abuse. So I have a unique understanding of how the hospitals are lying. To put it frankly, they're lying about being over capacity. They are really lying about how bad things are, and they have been since about May or June of 2020.
Well, you know what I noticed? It's really interesting, but when President Trump was running, every single day we had a death count. Every single day. And now we hear no death count at all on TV. The statistics are changing every day, and they also have lies of omission. They don't even tell you the statistics.
That's right. And also, I might add that while I was writing the H1N1 report, it was a total disaster, and none of this was told. At the time, we had a Democratic president in office, and the response had totally been messed up. The death numbers were never told. It was all shock. It was a surprise to me that things were as bad as they were, but the media never told us. Now, compare that to COVID, which hasn't really existed since, I don't know, it has not been a threat since about August of 2020. No.
So what is your main message today? I know that we have a website that we can direct people to that we will at the end, but what is your main message?
The main message is they are pushing fear. You do not need to be afraid from COVID-19. You do not need the vaccine because a vaccine is only effective up until the peak of the surge event. Otherwise, it will not materially prevent any deaths or injuries from the novel pandemic virus. The surge event peaked here at May of 2020, and so even if the vaccine is 100% safe and effective, it's not preventing any deaths because it wasn't out in time.
Just so you know, the Republican women, we do not take a stance on whether someone should get a vaccine or not. However, we take a very big stance on people having a choice, listening to people such as you. I don't think that there is as much talk, advertisement about what the dangers are of vaccines as them trying to promote it. So we appreciate all of your information. And what is the website that people can be directed to if they want to get more facts and information on the vaccine?
Well, you can email me directly, stratmcbride@gmail.com. That's STRATMCBRIDE @gmail.com. And I think probably my Twitter handle is the easiest. I'm HealthPolTruth, HealthPol Truth, TRUTH.
You know, Matt, you really have nothing to gain from this. You're not running for any political office. I know you work for a place that it could be a little bit dangerous to even speak out. So I appreciate what you're doing. I appreciate you sharing your information. And we believe in researching and presenting information for both sides. That's what Republican Women of Baltimore County is about. Thank you so much.
Thank you very much. It's been a pleasure speaking with you.
Okay.
Thanks.